You'll just tell me when to start after you.
Yeah, so it's now live. We'll just give people a few minutes to to start circling in, and then I'll introduce you.
Okay, great.
Yeah, so just give them a few minutes. Okay, I think we're good to start. It's 1 o'clock. This is Anissa Bektashi. I'm a projects manager over at the SIEDC. Thank you so much, Nancy, for joining us today. I'm here to introduce Nancy Sayegh-Rooney. She's the nurse navigator for the lung cancer screening program over at Rumsey, and she's also a tobacco specialist. Thank you so much again, Nancy, for joining us and for being able to show us this presentation and taking time out of your day to inform us about vaping and in general as the new epidemic. Thank you so much.
Well, thank you for inviting me. I appreciate being able to spread the word so that we can save more lives. So vaping is the new epidemic. So what do we know? What do you know? So you know that putting anything into your lungs is going to cause damage. So what exactly does all that mean? Um, so here you're looking at a Penn State football game,
Yeah.
and there's 106,000 people in that stadium.
Mhm.
So when you look at that stadium and you see all those little dots, and you say, that's a lot of people, there's a lot of little dots, but all
Mhm.
those little dots are mothers, fathers, sisters, brothers, aunts, and uncle. Well, 124,000 people die each year from lung cancer. So that whole stadium plus another section of, 18,000 people die each year from lung cancer. I think when you see the amount of people with the number, you can understand what that means. So what have we done to help save these people and not have stadiums of people each year die?
Mhm.
So that's what smokers, 124,000 that are actually smoking that entire stadium plus more. Now you cut that stadium in half, 64,000 people die from secondhand smoke exposure with lung cancer. So that's also pretty profound. That's a large amount of people, and you really don't want, we want to change that. So we've done a lot of things in the past to decrease smoking, but now there's a new population. But we still know that 34 million Americans are still smoking. That even with all the education and the anti-smoking that we have put out there, there are still 34 million people smoking. So why are they smoking and who is smoking? So we know it's men. We know it's adults right now from the ages 25 to 64 that are still smoking. We know it's of lower education. Maybe the information didn't get there. It's the poverty level. We know a lot of that the South and the Midwest are heavy smokers. The uninsured, people with disabilities, people that have psychological issues. Because we're going to get into it, but we have to remember that their smoking is an addiction. We know that a lot of the Native Americans and we know a lot of the lesbian, gays, and bisexuals are the adults that are smoking. So I just want to clarify, these are not the kids yet. These are the adults that are now still smoking, right? So what happens? Why are these people smoking? Well, most smokers started in adolescence. So what happened in that time frame is between peer pressure and the risk factor in the development of the brain, they're given that first cigarette. And the addiction to nicotine starts with the first inhalation, the first puff. The nicotine goes to the brain within 7 seconds. It goes to a part of the brain which is called the memory receptor, and there's a dopamine release, that relaxation, and the brain likes it. So here you have the addiction starts with that first puff. So as an adolescent, they inhale it and they enjoy it and they want more. Okay. So right now we know that in all of these e-cigs, these vapes, they're all unsafe. We know that. And what's in there is the nicotine. The nicotine is the most addicting drug there is. And it's in our vapes, it's in our e-cigs, it's in cigarettes, it's in your people that smoke pipes, it's in the hookah. Okay? So nearly all the tobacco products that are out there, the one common thing they have is nicotine. Okay? That's what everybody wants. Now we know in smoking cigarettes, I'm not talking about the vapes or the e-cigs. I'm talking about just cigarettes. There's over 7,000 chemicals. We know that 70 of those chemicals cause cancer. So that's the cigarette part of it, right? Now we're going to move on and we're going to talk about what's in the vapes and the e-cigs. But before we go there, why is this so important to get this information out to the kids? Because we need to speak to them and let them know this is a lifetime addiction. You don't want to be in that stadium, one of those people dying, right?
Yeah.
But it also affects the developing brain. It can impact learning. It can impact attention span. It can impact their memory. So if we if we speak to them now and we constantly speak to them and say, no, you don't even start with one puff, we can change it. We were changing it. We had a nation of anti-smokers. And what I think happened is we stopped the conversation. We thought the kids weren't doing it, but but the tobacco companies were losing money, and they come in the back door with the e-cigs and the vapes. And who are they selling it to? They're selling it to the teenagers. So right now we have a teenage smoking epidemic. 48% of your middle schoolers, that's your sixth, seventh, and eighth graders, are smoking these, are inhaling them. Let's use that. These vapes, these e-cigs. The CDC reported that 78% in 2017 to 18. We haven't gotten the stats for 19 yet. 78%. So that means what? 22% aren't? That's a big number. If you've ever gone to a high school, you open your car door and you see these little plastic things on the floor, those are pods. I'm going to explain to you what those are and what's in them. So, what took off is the Juul. The Juul was the most popular e-cigarette, and that's what you probably heard about. It was on 2020. They talked about that this was the alternative for adult smoking, but who were they marketing it to? We have to be smarter than what happened. Um, I don't know if you recall in 2019 when it was on 2020, they interviewed the CEO of the Jewel, and then he said everything was fine, that it didn't have any ill effects. And then some young children were getting ill, and then what happened? He left the company, right? So it's all about greed, it's all about money. So if you look at this graph and look at the red part of the graph, and you see in 2011 there were e-cigs were not really, the kids were not smoking them. If you look at the gray on the graph in 2011 and see where that started, that's what the kids were smoking, regular tobacco cigarettes. Now you follow the gray cigarette and it's down, but look at the red, the e-cigs, it's up. So we know this is happening and we need to educate them, because remember, knowledge is power. So what exactly is going on is that, pipes, if you look at this slide, kids are not smoking pipes. Hookah, yes, the young adults are going to hookah lounges. So, but let me just let you know that a hookah session, when they go to these hookah lounges and have a session, one hookah session is equivalent to smoking 100 cigarettes. So these young people that are going into these hookah lounges, the next morning, they tell them, oh, it's just flavored. It's just a flavored tobacco. That's not true. It's not only flavored, there's chemicals in there. And the next morning when your chest is killing you, you know why. You had an equivalent of 100 cigarettes. They're smokeless tobacco. The kids are not doing that. Cigars, maybe in college. But if you look, what are they smoking? The e-cigs. They're vaping. They don't even call it smoking, it's vaping. And when you talk to someone, and you ask them, do you smoke? They go, oh no. But now we have to now speak to them and say, are you vaping? Because they do not attribute it as being the same thing. So do you understand what vaping is? We know what smoking a cigarette is, but what exactly is vaping? It's the practice of inhaling and exhaling a vapor. It's not a tobacco, it's a liquid product that it stimulates the feeling of smoking, but it's not tobacco, it's liquid. And there is nicotine in it, and it's a device that helps the liquid to transform into a smoke. Now, I'm sure you've all been in the car and you see somebody driving ahead of you and they open the window and this big cloud comes out. How healthy could that cloud be? There is residual and secondhand and third-hand smoke, third-hand vapor residual on this, and that's a problem. People are getting sick. So the e-cigarette has been around for a long time. Initially, back in 1963. It was a smokeless tobacco that they created as an alternative back then to help with someone to quit smoking, right? And then a pharmacist patented in 2003. And we're just going to move ahead, and you can see Philip Morris said, oh, this looks interesting, right? And remember, Philip Morris, RJ Reynolds, Ultra, they all have shares and interests in keeping this going because it's all about money. So they initially patented a type of nicotine inhaler because remember, it's the nicotine.
Yep.
So then you fast forward to what's happening now, and we have the Juul has a patent. There's much more than just the Juul. Then you have the vape shops. And now the difference between the vape shops and going into a store and buying cigarettes is one is regulated by the FDA and one isn't. So we need to know what what we're putting in our body. So when you think about these vape shops, you have to think about knowing the product. When the gentleman goes in and gets you in the vape shop a strawberry shake inhalant and he goes in the back room, you have no idea what they're putting in there. It doesn't it it's not regulated by the government. These are the names that you see in front of you, are the names of what we call electronic nicotine delivery system. And they're the Miley, the Juul, the e-cigarette, the Sarin. So that's the name that we've given them that are sold on the marketplace. But the ones that you're picking up in the vape shop, nobody knows what's in there. No one knows what's in those cartridges. We know that these are non-combustible tobacco products. We know there's nicotine in there, and nicotine is the addicting drug, right? But there's a lot more in there. So this is what they look like. So what's happening in the youth population, these products are so small. The first one is the Juul. So that long stick is the cartridge that they heat up on the computer. And that little plastic that you see, those are the pods. That's what you see on the floor outside the high schools. And the liquid that's in there is so detrimental to our youth and to our our bodies. It's scary. Now the Juul is costs about $50 to get the starter set, right? The Miley is a little bit cheaper, but it looks just like that. Now you see the Sarin looks like a teardrop, and they can use it in school because remember there's not real any smoke. It's just they just take a puff, they put it in their sleeve of their hoodie, and nobody even knows that they're getting that hit of nicotine. Now the wax pen that you're looking at, that's what the vape shop bought. You get the liquid from those vape shops, and again, you don't know what's in that liquid. It could be anything. It could be Windex. You don't know what you're smoking because there is no regulation on that. So right now, the FDA, we're trying our best as advocates to get this regulation done because this is dangerous. So what's actually in the pod? We know that nicotine is in the pod. We know that's the most addictive drug. It's the most abused drug, but it's acceptable. That's the problem. Now, what else is in these pods is glycerol, which is similar to antifreeze. So you're smoking antifreeze. So when I speak to the high schoolers and the middle schoolers, and I explain to them, what antifreeze is, we have it on our driveways sometimes when it leaks out of your transmission or your car, and you always have to worry that the cats and the dogs don't lick it because it will kill them, but now you're smoking it. And you have to give people a visual to realize what they're putting in their body that's dangerous. Now the propylene glycerol is polyurethane. We know this is a cancer agent. We know this is in there. How good could it be? Then you have the benzoic acid. That's the insect repellent that you spray in the summertime. You don't like the smell of it when you're spraying it, but you're inhaling it. But then you have the vitamin E acetate. That's a thickening agent. And that's what they're using in the vape shops when they're smoking cannabis and THC. None of this should be going into your lungs. That's what you have to constantly think about. You're doing damage to your lungs. So, what about the difference between the nicotine and a pack of cigarettes? And I'm not condoning a pack of cigarettes. I'm saying you never should. But the difference in the nicotine in a jewel pod is 3 times the amount that's in a pack of cigarettes. So in a jewel, there's an equivalent of 60 milligrams of nicotine. In a pack of cigarettes, for every cigarette you smoke is equivalent to a milligram of nicotine. So now these young kids start off with their jewel. They take a rip, they call it. It's not a puff, it's a rip, and the nicotine goes to their brain. It says, this feels good. And the addiction starts with that first rip. So with that being said, you have to constantly talk about don't ever do it. Don't put your finger in the fire, because it's just dangerous. This is a danger to our lives, really, because it's a long-term effect. And the difference that we're seeing from smoking, as my role here at the hospital as a lung nurse navigator, we screen people for smoking for lung cancer that have smoked over 30 years. That's what a lung screening is. But we're seeing the effects to the lung in these young adults much sooner than 30 years. And I'm going to talk about that in a minute. So what are the effects of vaping? The e-cig and the Juul, I'm going to just keep telling you that nicotine is a highly addictive drug. The chemicals can do damage to your mouth, your nose, your lungs. Your lungs, without your breath, we can't exist. It is a gateway drug to a lifetime of nicotine dependency. Very, very, very rarely does any adult start smoking in their adult life. Every one of my patients that come in for a lung screening have started in their teens. There's very, very few that have started in their 20s. It's something that happens, and you have to think about, why is that happening? It's because of the risk factor in that developing brain. And once that addiction starts, it is one of the hardest addictions to overcome. Now, what's happening with the vapes and the e-cigs is that they're putting in chemicals and they're putting in flavoring. Because believe me, no adult wants to be smoking bubble gum. But if they're enticing these children with bubble gum, chocolate, strawberry sundae, it's a wolf in sheep's clothing. And the most popular flavor in these products is mango. Try me, I'm mango. And that's how they lure these kids in. So we're creating a new generation of addicts, and the addiction is nicotine. Look, and they're saying, look at this marketing.
Mm-hmm.
Who is that? They're not marketing to adults. They're marketing this to young people. They're trying to entice sweet and fruity, cheesecake. This is what the marketing is out there. This is what the kids are seeing. We worked so hard in the smoking professionals that have been trying to get them to not advertise in the delis, not have the posters for the tobacco products at children's levels, and then this comes up. So now there is another thing that came up. So they're not just smoking, now they're freebasing nicotine salts. And they can buy this at the vape shops. And again, they can get these products online. Nobody is checking the age ID online. And these products are dangerous. You don't know who is making these products, what they are. And so they're freebasing these nicotine salts. And you may ask yourself, why do they do this? Because it gives them a euphoric sensation of relaxation with that dopamine release. But this is the nicotine salts are even more dangerous than the Juul. They're all dangerous, but this is um, a whole nother area because they're using this in freebasing and that you don't know what else they're putting in there.
Mhm.
So as advocates, what are we doing? We need to increase the pricing. We're doing the indoor restrictions. There are different strategies. Before COVID, there were they were giving out tickets or fines
Mhm.
to any store or Walmart or Target that were any of these where any of these products were being sold over the counter to young adults, they were being fined. So the FDA was trying to regulate it that way. Also, the indoor restrictions. People think that they can vape and they can use an e-cig indoors because they're saying it's not tobacco. That's not true
Mhm.
because there is still secondhand smoke involved in it or secondhand vapors. So and what we've also done in the advocacy world is restricted the flavors, the sale of flavored, because we know that that's enticing the children. Um, so we've also doing education, like I said, the FDA, there's a prevention plan out there. We're trying to curb the marketing, but now you have to think about what happened here in the United States when we were in shutdown. So now you have all these young kids that were using the Juul, going to vape shops. Now they were home and they didn't have the product that they wanted. So what were they going to use? Cigarettes. They needed their nicotine addiction. They were going to reach for the cigarette. And that's really the back door of all this. And it keeps the tobacco companies afloat because then they have another generation of smoking. So, what happens? Why is this so important that we need to talk about it? And what are the clinical implications? So, we're in a crazy world right now with COVID and vaping. So, we're seeing that there is an increase of COVID in the teens and young adults. There was a new study done by Stanford, and it has to do with they're coming in and getting tested because they're having symptoms. Because remember, when you have young children, when you have young adults gathering, They're sharing that vape product. They're sharing the Juul or the Miley. Can I get a rip on it? Can I get a hit? Um, and it's really very sad, but we are seeing an increase of that age group with COVID because they are coming in with symptoms. And they're it's and remember the lung damage. Their lungs are now having issues. So now is really the time for the FDA and for all of us that are out there to advocate for this to get some changes on the table so that we don't go down that same rope and have a whole stadium die. Now the kids all heard about this and you may have heard about it too. What about popcorn lung? So what exactly is popcorn lung and why do they talk about it with vaping? Well, it has to do with the flavoring. So they first saw this type of lung bronchiolitis in the popcorn factories where they make the microwave popcorn. So the additive that they're using, they saw actually 8 of their employees got very sick with this irreversible lung damage. And that's where I'm sorry, my lips are getting tired of talking. That's where the phrase of popcorn lung came from that popcorn factory. So then that flavoring is now taken out, right? And so now these popcorn factories aren't using that. So they have barrels and barrels of all this flavoring and it's in these warehouses. Well, guess what? Guess who's using that popcorn flavoring? these e-cig companies and their flavor. Well, if we can't use it for that, then we might as well put it in here. And so they were sold, and that was found out, and that's a problem. You know, so that's where, that's why these kids are getting sick, and that's where the phrase popcorn lung came from. So we don't want that either. So now you have damage from smoking, damage from vaping, and so when you put all this together, we saw this lung injury, we see the surge in the use and the vaping. Now we have an epidemic of irreversible lung damage, and so that's where this came from, because all of this came together. And if you recall, in last August of 2019, there was an outbreak in Wisconsin, and there were multiple kids that got very sick, and that's where the CDC said we need a name for this disease because it was something that we never saw before, and that's where Eval came in, which is e-cig vaping product associated lung injury. Okay, so we've never seen this before, and now, because of that epidemic, because of all these young kids, so now in healthcare we have to ask that question: are you a smoker? Are you using any vaping products? So it's not just smoking anymore. We have to ask that question because they do not associate them as the same, but we as healthcare professionals have to ask that question. Now, in the past year in New York City, 3 young people have died from the eval. In the country, 57 cases resulted in death. Um, So in Europe, when I forgot to tell you this, the nicotine salts that they were using, that they were heating, are no longer they're prohibited to even sell that because of what has happened. So it's a scary time. We need these kids to understand that with COVID, we don't need anything else to go in your lung other than the air you breathe.
Mhm.
So how did they diagnose this eval? So it mimics the same symptoms of pneumonia and the flu, but we don't know long-term effects. They come in with shortness of breath, they have fever, they have diarrhea, vomiting. Sounds sort of like COVID too, right? So it mimics everything, but you have to get a good history and find out what exactly happened and when did this occur, because this happens to the kids very quickly right after they've been using the product. It could happen within 2 weeks. It could happen within a week. It could happen in 3 months, but you have to find out, are you using this product? So how do they treat this? They treat it with steroids, antibiotics, antivirals. But the issue really is they get diagnosed, but we can't predict what's going to happen if they use the product again. Are they going to have another episode of this lung injury? So when I talk about a lung injury, they can't breathe. And that's what brings them to the hospital. It's not just a little cough. They can't breathe. So we still have a lot of unanswered questions, and the research is still pending, and we don't know the long-term effects. What we do know is that smoking cigarettes has a long-term effect, and we start seeing those effects in 30 to 40 years. But what we do know is that using vapes and e-cigs are having an effect in a sooner time. It's happening quicker than the 30 years. So this is an issue that we're going to be seeing a lot more of as these kids go back to school, and they're socializing and they're sharing these products. It's going to be an issue again. So how do we change this? Well, we have to continue doing some investigating. We have to get the public message out there. We've got to tell the kids, just don't ever, just say no. You know, years ago there was a campaign that used to say no to drugs. Now we need to say no to this. No chemical should go into your lung other than the air you breathe. Okay? So, if you recall a few slides ago, we were talking about vitamin E,
Mhm.
the vitamin E oil that they use with the THC, which is the cannabis. So that oil, no oil should ever go in your lung. And that causes irreversible lung damage. When I say the lungs do not heal the way your skin heals. If you get a cut, you're going to heal, you're going to get a scar. But when you have a scar tissue happening in your lungs, that means there's no oxygen going to that area. So that's irreversible. You can't get a new set of lungs. And I'm going to tell you, I was in a school, I guess it was about a year ago when I was teaching, I was going over this vaping issue with with these high schoolers. And the first class was a freshman class, and they raised their hand and they said, I was telling them about the irreversible lung damage, and they said, well, oh, I can just get a lung transplant. And I said, excuse me, you, you don't go to Target and get a lung off the shelf. It doesn't happen that way. Well, because the media had put out that story about this young boy that did get a lung transplant, that's not how it happens. And so then the next class, the 10 o'clock class, were sophomores and juniors, and they raised their hand and said the same thing. And then the seniors said the same thing. And I'm saying, this generation thinks that our bodies have interchangeable parts and we can just get a new lung. And we really need to educate them how important our lungs are. This month of November is Lung Cancer Awareness Month. And our breath is so important because without our breath, there is no life. What I want to emphasize here is that it is Lung Cancer Awareness Month, and who gets a lung screening. And my role here at the hospital is the Lung Nurse Navigator of the Lung Cancer Screening Program. So any family member or anybody that is a smoker, an adult, that has been smoking for the past 30 years and is of the age of 55 and older should have a lung screening. And that consists of a low-dose CAT scan. It takes all of 3 minutes, but it can save your life, because just like women going for mammography saves lives, lung cancer screening saves lives. So we don't want this next generation to have a screening program for lung cancer or for lung damage. So let's get the word out there to encourage everybody not to ever pick up these products. Let's be advocates. I understand that, vaping shops is a business, but it needs to be controlled, and we need to know what's harming our children. And any questions, you can always call me at the lung screening program. And if you need help with learning how to quit, if you have anybody that needs assistance with tobacco cessation, I am a tobacco specialist and would be more than happy to help anybody.
Thank you so much, Nancy. We really appreciate it. And thank you so much for this presentation. It's very informative. I myself didn't know a few things on here, so I really appreciate the education that you've given all of us here. I wanted to open up the board for a few questions. We can give some people a few moments just to see if they have any questions. Just to start it off, actually, I had a question myself, just to kind of touch base on the FDA regulations. Are these products not regulated by the FDA?
Not yet.
Not
So a regular tobacco, the reason tobacco is so expensive in New York State is there's a tobacco tax.
right.
And so these products are not considered tobacco because according to the FDA, tobacco products are tobacco leaves wrapped in paper. So
Right.
they're taxed as a tobacco product. These are not, because of their description, under the FDA being taxed, but that's what we're advocating, that these are nicotine products, and they need to be regulated by the government, and they need to be taxed just like that. So once these things do happen, those vape shops are going to go out of business because the kids can't afford it.
Yep.
So it's a cycle, and I believe during our lockdown those shops were closed as well, correct?
Mhm.
So yes, we're working on that, and we have to just keep, as the adults, as the educators, we have to just keep letting these kids know, don't ever start.
Thank you so much, Nancy. Thank you so much for your time and for putting work into this presentation that I know we all enjoyed. We really
Uh,
appreciate you being on here.
Thank you. Any questions?
No, I don't see any here. We can wait a few other moments as well, but I don't know. As of now, there are no questions. If there's anything else that you wanted to add, we'd really appreciate that as well.
Um, I think I tell you everything.
You did. It was very informative. Your presentation was really great. Thank you so much.
You're very welcome.
All right. Thank you so much, Nancy. Thank
Thank
you
you.
everyone for joining. Thank you.
Thank you. Bye-bye.
Bye.